Hi everyone. Today I'm sharing a video on cobalamin, that is vitamin B12. Vitamin B12 is present in three compounds. One is methylcobalamin, another one is 5-deoxyadenosylcobalamin, third one is cyanocobalamin. Methylcobalamin and 5-deoxyadenosylcobalamin are the active forms which are found in the body, while cyanocobalamin is the most commonly available commercial form. Now we talk of sources. In animals, vitamin B12 is produced by the intestinal microorganisms. But in human, it is not produced by intestinal microorganisms. So we need to take it in the diet. Now this B12 is available either in the dairy products or in the eggs, meat. In meat, it is present in the organs like liver, kidney, heart, muscle meat and all that. So we depend on animals for the B12. So the person who is absolutely vegetarian in diet takes a vegan diet is prone to B12 deficiency. Now, if we talk of absorption, once you have taken in diet, which is present in the dairy product, eggs or meats, so once you take it, what happens it, this B12 goes inside and it combines with the intrinsic factor. This intrinsic factor is a glycoprotein which is produced by the gastric parietal cells. Now this B12 after combining with intrinsic factor gets absorbed by the active process through receptor mediated process in the ileum, that is terminal ileum. Now after combining with this, it will get absorbed in the ileum and after that in plasma it will combine with the transcobalamin 2 for the transportation. Also, along with the intrinsic factor there was active absorption. Also a small fraction of B12 is passively absorbed through the diffusion process. Also the T half of the B12 is increased by the anterohepatic circulation. Now if we see the requirement of the B12, so the recommended intake of the B12 for infants is 0.3 microgram per day. For older children it is 0.5 to 1.5 microgram per day, and for adolescent it is 2 gram per day. You can remember it with the 3 do 5. So in infants it is 0.3, adolescent it is 2 microgram, and older children it is 0.5 to 1.5 microgram. Now if we talk of deficiency, what happens if the person follows the vegan diet, he takes no animal or fish products, then there will be true dietary deficiency of vitamin B12 in that person, and it will manifest as a B12 deficiency. Another thing, if the patient is or the person is deficient in intrinsic factor, so there will be impaired absorption of the B12 due to deficiency of intrinsic factor. We call it as pernicious anemia. In this pernicious anemia, if we give mega doses of B12, so there will be a small fraction which will be passively diffused. So that is why mega doses are recommended in the intrinsic factor deficiency. Another thing, if the patient is having any ileal disease, also again there will be no absorption of the B12, so there will be B12 deficiency. Another thing, if we talk of the newborns, the content of the vitamin B12 in breast milk is decided by the maternal intake of the B12 and levels of B12 in the mother. So अगर कोई एक्सक्लूसिवली ब्रेस्ट फीड बच्चा है जिसकी मदर स्ट्रिक्ट वेगान डाइट पे है, उसको अगर टाइमली वीन ऑफ नहीं किया तो द चाइल्ड विल be prone for the development of the B12 deficiency. Another thing, if we want to assess the B12 deficiency, what we need to do is we need to go for the serum B12 levels, and if they are less than 150 picogram per ml, that suggests the B12 deficiency. Also the byproducts like methylmalonic acid or homocysteine levels will be raised because the B12 dependent steps of metabolism will be blocked. So these levels will be higher in the plasma. So for assessment we need to remember that serum B12 will be less than 150 picogram per ml in the children with the B12 deficiency. The clinical features of B12 deficiency. So basically there occurs the demyelination. There is problem in the myelin production, and also there is deficiency in the methyl group. So there will be a defective myelination. Due to the progressive demyelination, there will be manifestation of the symptoms. So initially the demyelination will affect the peripheral nerves. It will progress to involve the posterior and lateral column of the spinal cord, and later on central nervous system will be involved, and we call it as subacute combined degeneration. Another thing, there will be a secondary folate deficiency, and there will be the presentation as megaloblastic anemia, that is in the form of macrocytic anemia. Nucleated RBCs will be present. Also there will be hypersegmented neutrophils, thrombocytopenia, and serum LDH will be raised in such patients. Now how we are going to treat this patient? So we are going to treat this patient by the parenteral B12 administration, that is 1000 micrograms of 1 mg per day. We are going to give it for 1 to 2 weeks, and also the reticulocytosis starts occurring in 2 to 4 days of treatment. Thank you.